Okay, so I think we're good to start. On behalf of the CLL Advocates Network, I would like to welcome you all to this important webinar on how to sustainably build and develop a patient group. You will hear updates from CLL patient organisations, my own one, CLL Ireland. You'll hear about sustainability and service delivery in current times, these difficult times. This webinar aims to empower patient advocates and leaders of new and established patient groups by discussing lessons learned by the panel during the forming of the organisations and the early years. And I'd like to hand you over to Brian Garden, who's moderating this webinar.
Michael, thank you very much for that introduction. My name is Brian Garden, and I'm a trustee of CLL Support, which is the UK CLL agency. We have a very full program today, so I want to crack on as fast as we possibly can. But before we start, I just want to go through some housekeeping notes so that everybody understands where we are. Our audience will be muted. If you would need to ask a question, and we encourage questions, please use the chat function at the bottom of your screens. We have a lot of questions already, but we'll try to answer as many as we can during the course of the Q&A session, which will be after all the presentations. This webinar is being recorded and it will be available for future viewing on our website. So, the panel, I've introduced myself. You've already seen Michael Rinn. We have Neil Graham, whose talk has been videoed because he's from New Zealand, and the time distance between us and them doesn't allow for it to be live. I'm going to ask now Apandeo to introduce himself, please. You're mute, Apandeo. Hi, yeah, okay. We can hear you now.
Yeah, my name is Apandeo Mshiana, founder CLL Patient Support Group Tanzania and the Executive Secretary Blood Cancer Foundation Tanzania. I'm here to present a topic on building and development a sustainable patient support group. Okay, thank you.
Thank you very much, Apandeo. Stay with us. And now let me introduce Lorna Warwick.
Hi, I'm Lorna Warwick. I'm the CEO of the Lymphoma Coalition, which is a global network of patient organizations that support patients with lymphomas, including CLL. And I'm happy to be here to share with you today. Thank
you, Lorna, very much indeed. Right, let's get on to our first talk, which goes back to Michael, who's co-founder of CLL Ireland. Michael, can I hand over to you, please?
Yeah, thanks very much, Brian. Okay, so look, to start, CLL Ireland was founded probably back in 2014 because my wife, Jan, was diagnosed with CLL in 2011. We quickly found that in Ireland, there's approximately 250 diagnosed each year and about 2,500 living with CLL. But when my wife was diagnosed, we had difficulty accessing information, and we obviously no access to the new novel therapies and very few CLL trials. So this led us to actually reach out to other patient advocates in other countries and learn about CLL and learn about what we needed to do, and this was the start of the road of advocacy. We aim to encourage and empower CLL patients and carers. Our journey, we became a registered charity in 2017. Our very first information day in 2017, we were overwhelmed that we had 146 attendees. We pre-COVID, we tried to have about 3 information days around Ireland, and they would average about 100 patients and their families coming to hear about all the new treatments, and we get expert speakers in, and maybe psychological support and that stuff. We've been very busy on social media, as some of you probably see. We also get involved in some collaborations with organisations in Ireland, and we did the Make Blood Cancer Visible, which was very successful. We try and do political awareness TV and media coverage, and probably close to my heart is the people that I work with in CLLAN and other collaborations. We go to the next slide. This is just giving you an idea of some of the things that we were involved in to try and highlight that the Make Blood Cancer Visible one is there. The survivorship conference that Irish Cancer Society hold each year is very beneficial, and we always try and have a stand on it. One of our members, Jan Ray, and my wife, is on the Precision Oncology Governance Committee, which is very good for her to get to see what's happening in the research end of things and feed that information back to us. I'll go to the next slide. Okay, so look, creating awareness, as you know, can be a difficult thing, especially with a disease like CLL that's a hidden blood cancer, and a lot of people that you're reaching out to wouldn't know a lot about CLL. So we try and raise public and political awareness. We provide accurate and up-to-date information, and obviously coming from the people that we collaborate with around the world. And we've been on community advisory boards, increase our reach and optimize engagement, and follow good governance. I suppose what I will say here is that when we started this journey, with a lack of information here, and a lack of, to give you an idea, that my wife in 2014 started on ibrutinib, which a lot of you will be familiar with, and she had to go to the UK, travel to another country to get that drug, and that drug is still not approved in Ireland, that we have no access at all, even in 2021, to any of the novel therapies to frontline patients. So this gives the importance of advocating. I'll go to the next slide. Just to show you some of the collaborations that we've been involved with. All of you are obviously very familiar with the CLL Advocates Network. We've carried out surveys in collaboration with Lymphoma Coalition, CLL Society we work very closely with. Itemize was an organisation that is an umbrella group for patient organisations here in Ireland, where we can kind of group together to maybe lobby for certain things. Leukemia Care, you know very well, and CLL Support, we collaborated with on a recent webinar, which we got very good feedback from our patient community. It was very important. So I'll go to the next slide. So we can't have a talk about the impact of COVID, and COVID has kind of changed the whole landscape for CLL patients and all of us. But CLL patients mostly because of the immune compromised nature of the disease. In our country here in Ireland, things went terribly wrong last January. We had the highest in the world. All changed utterly, as that slide shows. We had 1,000 deaths in January, and on one day in January we had more than 8,000 cases. The impact of COVID on the patient community is that patients have had appointments cancelled, patients have treatment delayed or cancelled. The information and advice that we're getting from our governments and our healthcare providers is very misleading, and it's kind of maybe leaving the CLL community in the dark. Patients weren't prioritised for vaccination, and I'll bring that up. That's probably, obviously vaccination is important, but where it really highlighted the lack of awareness for CLL patients here in Ireland is that when the vaccination was being rolled out, they had our CLL patients in cohort 7, which meant that it would have been about 6 months from the time the vaccination rollout had started before a CLL patient was considered. So we had to group with Itemize and the Irish Cancer Society, and we had to lobby for CLL patients to be prioritised for vaccination, as you would. But what happened was that they actually moved the CLL patients that were in treatment up to cohort 4, but they left all of the ones that were in watch and wait or watch and worry in cohort 7, which kind of didn't make sense. So we had to lobby again and go back at them and say, well, our CLL community, in some of them on watch and wait, can be quite sick and quite immune compromised. And we eventually got them moved up, but it just kind of shows the lack of awareness that you have to keep highlighting these to experts. In also our patient community, there was no support for families who cannot send children to school. A lot of families here in Ireland with CLL that have young children the risks were just too great with the numbers so high. And the Department of Education here in Ireland determined that schools were safe and that we should send our children to school. And it just showed another lack of awareness. Vulnerable groups were not consulted on decisions. And as we can see, if you ignore vulnerable groups in this, if you're not listening to vulnerable groups, how can you make decisions that will actually improve their lives? And patients feel isolated. Next slide. So I suppose the impact for us as an organisation, you could fill this slide up with many topics, but we've had no face-to-face meetings with our patient community. We've had to learn new ways of reaching out to the community by holding webinars, chat groups. We created a Facebook page for our patient community, and that was quite good actually during the vaccination process, because when the vaccination was prioritised to the patients, to CLL patients, we actually found that the patients were coming on this chat group and saying that they were going to the doctor saying, I'm in cohort 4, and the doctors were saying, no, you're not. So we had that kind of difficulty, but it was good to get that feedback, and then we were able to supply that information to the patient community. So the patient community were able to nearly inform the doctor, you know, that's no, I'm in cohort 4 and I should be vaccinated. We've obviously had those the usual stuff that we hear in our advocacy, and when we go to our CLLAN Horizons meetings, is that the digital challenges for our older and rural patients, and that's something that we're always trying to work on. We've, in collaboration with Leukemia Care, they kindly offered their booklet that we could print to an Irish audience, and that we're rolling that out at the moment, and that will go to all the rural centres so patients can have access to information. Obviously, sustainability, I'd be interested as this conversation goes on with the rest of the panel, but difficult to recruit volunteers during a pandemic. That's a really difficult one, because, you know, as most of you know, we all work as kind of a close team, and if you can't kind of get to meet people face to face, especially new volunteers. So look, that's our organisation there. You're all very welcome to join us on Facebook and all our social media. So I suppose I don't have much more to ask, and I appreciate the opportunity actually to tell the story from CLL Ireland's viewpoint, and look forward to the panel discussion later on. And I'd like to thank you very much.
Thank you, Michael. I think it's really quite amazing what you've achieved over a very short period of time, and I'm sure we'll be coming back during the Q&A session towards the end to ask you what the difficulties were in the early years, because that's the formation period is so crucial. I know. Right. Thanks, Michael.
Thank you.
We now move on to the next. It's a video, in fact, from Dr. Neil Graham, and it's. Although it's a video, I think you'll find it very instructive, particularly from the point of view of the sustainability of a small charity, and in terms of succession planning, which are quite important elements of it. So let's have a look at the video now.
Good morning. Neil Graham is my name. I'm a consultant physician, an internal medicine specialist from New Zealand. And today I'm going to talk about setting up a patient support group for chronic lymphocytic leukemia. And that was a presentation I gave in Edinburgh at the Horizons meeting in 2019. And then I'm giving an update of what we've done since then. My main reason for involvement is that I developed CLL about 20 years ago at the age of 50. And I'm a survivor. I've had the numerous orthodox treatments as outlined there. I had FCR for 6 months, getting 8 years of remission. And then I had a 4-month course of FCR again and got 2 years of remission. I got into real trouble 7 years ago when I had bone marrow failure that was transfusion dependent. And I fortunately got onto ibrutinib then, which really saved my life. I've had a number of complications as listed there. A lot have been respiratory, and I've recently had a bad bout of cellulitis, which was relatively refractory to treatment. So you need to be on the alert for complications all the time. One of the main reasons for setting up CLLANs was due to a lack of funding for modern medications for this condition, and also modern medications for other cancers particularly. Pharmac is New Zealand's drug funding agency. They've been in existence for more than 20 years, and they've been recognised internationally for effective negotiation of drug prices. But in the new era of expensive drugs, where there really has been some transformative developments in cancer therapy particularly, they've chosen to be very slow in their response and often not fund these medications, which we've called rationing by delay. They also have no rapid access scheme for medications that work well, and they seem to have become rather anachronistic. Some facts about medications. Ibrutinib is in a list of 45 countries, where New Zealand is the only country where ibrutinib is not funded. And New Zealand is last out of a list of OECD countries for market access to modern medications. One of the main reasons for this is we invest only 5% of our total health budget on medications, and for most countries that's 10 to 15% or even more. Australia has a very similar health system to ours, quite a socialist system, and in comparison to Australia, particularly cancer medications in Australia, there are 33 that are funded in Australia that are not funded in New Zealand. There are also 16 diabetic medications and cardiovascular and rare disorder medications that are not funded in New Zealand that are in Australia. So the motivation for setting up CLLANs was, as I've already mentioned, mainly an advocacy for funding for modern medications, but also we have embarked upon programs for education and support, and a database for access of CLLANs people to our website, for example. And we've also tried to link with many similar groups, particularly patient support groups in New Zealand, but also patient support groups and others internationally. We try not to duplicate their work. Our infrastructure is outlined here. We have an active board of trustees, myself in the top left-hand corner. Next to me is Ben Schrader, who has a PhD in history and who has CLL. Below me is a dynamic young lawyer, a partner of a firm in New Zealand, and then beside her, our project manager, who has a background in journalism and who has been a major part of our success story, and then a hematologist at the bottom, a consultant hematologist. We have done the bureaucracy involved in setting up an organisation, such as obtaining charitable status. We've had a strategic plan, which I think has been a very important part of our success, and we have organised our finances well. We continue to develop our website, and we have joined up with various other groups, as I've mentioned, and particularly other New Zealand patients advocacy groups. We have actively involved the media. Here is a detailed slide of our strategic plan, and I just show it to you because we're serious about what we're doing, and we've got a well worked out plan for the short and long term. We've got numerous supporters and funders, and these are listed here. I particularly wanted to mention the bottom three, CLLAN, Patient Power and Leukemia Care, who have shared a lot of their resources with us and saved us a lot of time and effort as a consequence in providing what they provide for their groups. I wanted now to discuss what we've done in recent times. This is a slide about the website, and some examples. And on the right there is a video of me welcoming people to CLLANs. We have a private Facebook group where people join in and ask questions or make comments about things, and here's an example of a Facebook page. We've organised last year a patient seminar which was held in Auckland in the leukemia and blood cancer buildings in Auckland, and which was addressed by 3 of New Zealand's authorities on CLL. It was a very successful meeting, well attended both in person at the LBC Centre and by Zoom up and down the country. A lot of good feedback was received, and we have got the talks on our website for access for anyone who wants them. We've had marches on Parliament with other patient support groups, and we've presented petitions to MPs. So here's the big photo is MPs waiting to receive petitions and the Parliament buildings of New Zealand in the background. We've made in-person petitions and presentations to health select committees, and here's us doing that in Wellington. And we've also involved the media as much as we can, and here's a selection of media reports about CLLANs and about lobbying in relation to CLL and other medications particularly. In collaboration with Leukemia Care UK, we have modified their patient booklet for our own purposes, and we have distributed this over 1,000 hard copies, mainly to consultant hematologists and to hematology nurse specialists, as well as patients. This document can be downloaded on the website, and we give hard copies out readily. Our current work in progress is listed here. We're in the middle of making a further submission to a pharmac review panel. We've recently got involved in research, doing a study on CLL and secondary malignancies in New Zealand, and this has been submitted for publication. And we're working with the Leukemia Foundation of Australia, who's put a fantastic document together about blood cancers and the management thereof, and they've given us access to this document and allowed us to develop a modification for New Zealand of the document. You should take the opportunity, if you can, to read this document. It really is quite superb. Our current priorities in our work are listed here. Priority 1 is the BTK inhibitor approval for relapsed CLL and also for older people as first-line therapy and the funding thereof. Therefore, we're working towards reforming first-line therapy to include the option of ibrutinib once it is funded. And we've also spent a bit of time talking about preventing infections. I also wanted to mention succession planning in our group and other groups. I think patient support groups often don't do this quite as well as they need to. And this was highlighted to us quite recently when 2 of us, who are big drivers of CLLANs in New Zealand, got sick at the same time. And we had a lot of problems keeping the organisation ticking over. And I think that this has happened in numerous other similar organisations, and I think that that needs to be dealt with because it does undermine the flow of the organisation. Okay, so we've been, I think, very successful. The gestalt is high in our group. We've made things happen, and this has a lot to do with our project manager, who has made a fantastic job of what is required. We've had, as mentioned, strong strategic planning and we have delivered on this plan. We spent a lot of time over getting funds and delivering value for the funders, and we've collaborated with other groups, as mentioned numerous times. We have a tight focus at any one time on a relatively limited number of issues, and we've seized opportunities, particularly with the media and making submissions to government, etc. And we're a small, nimble and committed team that has achieved a lot. We've got quite a lot to do, but I think we've already made a difference. Thank you.
Well, sincere thanks to Dr. Graham for sharing his experience. I did mention the two key things that he mentioned during his talk about succession planning, and particularly for a small charity, and sustainability. They're both, but he also mentioned a further one, which Michael also mentioned, and that's a question of campaigning, because we are advocates for CLL patients, and the campaigning element in Dr. Graham's talk was, I think, quite impressive. So we now come to our final speaker, Abadeo, who'll be talking about building and developing sustainable support group in a large country with a difficult environment. So let me now introduce Abadeo.
Yeah, my name is Yapendavyo Mshana from Tanzania. As I've said before, the founder of CLL Patient Support Group Tanzania, and the executive secretary, Blood Cancer Foundation. Yeah, the whole story starts like this, that I was diagnosed having CLL in 2009. And since then, I had to attend the hematological clinic in Muhimbili Hospital regularly to date. Muhimbili National Hospital is located about 300 kilometers from my place of domicile. And life by then was not so easy, because I was always thinking about the disease and how the change in livelihood would change my focus. Now, since then, I started to learn about CLL online and checking some books to get more insights as far as blood cancer is concerned. It is by that time I came to learn that actually I know nothing about blood cancer, and therefore I have to put more effort on how to manage it. In the year 2019, I was invited to attend a CLL Advocates Network conference that is held in Edinburgh, Scotland, where I had an opportunity to get a wide exposure concerning CLL and blood cancer in general. When I come back, my ambition was to see into it that I call upon few individuals to support me in establishing an organization that will take care of creating awareness of the blood cancer. Now, it has not been easy. First of all, I was totally ignorant and lacking knowledge on how to start an organization. It was too difficult to access patients simply because those who come for clinic soon after consulting the doctors goes away. Even if you call them for a short discussion, they become less interested. After all, I am not a professional doctor, therefore they see it as a wastage of time. On the other hand, for those who decided to join, disappear after some few times. Most of the politicians are also difficult to handle them because they have a lot to do, and they have different priorities on various national programs, and therefore tend to put more effort on communicable diseases. Healthcare workers are also busy and overwhelmed. Tanzania have very few hematologists, approximately 17 only. The media section, on the other hand, are more interested on series or stories. They can easily become available if you are called for a special occasion or events, of which we as a group, we do not perform because we are not yet fully registered. Next, please. It has been very, very complicated. For this experience, I've come to learn the following 5 lessons. That's one need to understand your population, environment, and circumstances you are working with. Tanzania is a big country having a population of 56.7 million people, and approximately more than 54% have access to clean drinking water, and about 24% have access to improved sanitary facilitation. And most pressing health challenge by then was malaria, HIV, and communicable diseases. And almost 26% of the population reside in the urban area. Next, please. On our population doesn't know about blood cancer, and chronic lymphocytic leukemia is ahead of. Even patients who are able or are being treated for it will not tell you about CLL. They will tell you that they have blood cancer. But then initially, people were very much thinking of the malaria, tuberculosis, HIV, diarrhea, which is a communicable diseases. But later on, some 10 years from now, 10 years back, came to be forced to think about non-communicable diseases, the hypertension, cancer, mostly breast cancer, cervical, and the prostate. But now, 2 years ago, people forced to think about COVID. Everybody was talking of COVID, 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 COVID. People were afraid to travel, fear of COVID, difficulty to see patients, CLL patients, older enough people, and they have no access to smartphones. Zoom is not familiar to everybody, and so do I. Internet connection was a problem. The finances is also a problem. And therefore, in order to become successful, somebody needed to talk to them or to meet somebody somewhere else and to talk to them from the perspective of blood cancer. Invite them into a group where we'll then learn about the different types of blood cancer, including CLL. You need to listen to them, to their concern, their fears, and to listen to their challenges. It takes time to realize their needs. Try to reduce formalities, to be open and straightforward when dealing with the issues. Next, please. From the beginning, we had a lot of good plans on paper, but what we had carefully planned on papers proved very difficult to implement. Therefore, we decided to go for a new strategy that reminded us to think about the nature of the participants. So we decided to hold a meeting with a few patients and healthcare workers to brainstorm on our challenges and think of possible solution and the best way forward. During our discussion, I learned that there were many other blood cancers, and although they all needed support groups, none of them actually had a functioning group. There were very little awareness and almost no political will. Then after that, I learned that you need to be open-minded, ready to receive new suggestions. For that matter, we came up with new versions. Our vision, our new version or vision was to organize ourselves and start a new foundation. Hence, Blood Cancer Foundation Tanzania was established. This Blood Cancer Foundation was established, and we came to see to it that we needed to join people of any caliber, anyone with blood cancer, relatives of patients and the caregivers, hematologists and other healthcare workers, other non-health professionals who have vested interested contributing to the growth of the foundation. And we said that, why should we do all this? We do this because we want to support healthcare services for patients and blood cancers, support the research on blood cancers, advocate campaigning, patient support group for specific blood cancers. So we where are we now? For the moment, we have managed to have a constitution, and then the constitution has been drafted and finalized. Registration of the foundation in progress and will be complete in the next 2 weeks. Our plan is to conduct in the next meeting at the end of July, our first activity being World Leukemia Day, which is going to take place on 4th September 21. And our main objective on World Leukemia, apart from raising awareness on leukemia as one of the blood cancer, introduce the Blood Cancer Foundation for Tanzania to the nation, and also to try to initiate enrollment into support groups for different blood cancers, leukemia, lymphoma, myeloma, and then to look for companies and organizations within and outside the country to support our foundation. Next. We also came to realize that we needed to come up with ways which will work for us. Our situation is unique, and therefore we need to come up with unique workable solution if we are to be sustainable. We need to try different means and find out which one works best and which one is almost inclusive. Next. For that matter, we need to have a well-organized programs, the preparation of proposal for World Leukemia Day, raisings of fund. Like now we have been forced to contribute monies from our own pockets in order to pay rent for our office. We need money for helpline, airtime need money, campaign need money. So we are now looking for a campaign or a company who will be ready to support the foundation in running the events. So what we say, keep trying until it works. Thank you.
Apideo, thank you very much for an impressive and most inspiring presentation. You've shown what can be achieved even in the most difficult of circumstances, and you're certainly making a difference in your country. I think you've shown how important it is to have flexibility and to listen to people. And I love that last slide, keep trying until it works. Brilliant. Okay, we now move on to the discussion and questions and answers. A reminder that you can submit any questions by using the chat function at the bottom of the screen, and we'll try and get through as many as we can before the end. Okay, could everybody put their video on and unmute, please? Okay, we're getting there. That's great. Thanks a lot, everyone. Well, welcome again to everybody. Thank you for joining us. Let's get back to a few basics. Michael, can I start with you, please? What did you find when you started to set up the charity? What your initial challenge was? What areas were you looking at in order to be able to form the charity in the first place?
Well, we were quite fortunate in that we were actually trying to replicate what the CLL Support Association in the UK were doing, because we had no information or no meeting days in Ireland provided to us to inform us about CLL. So what we did was we traveled to a few conferences in the UK, and these conferences, when we saw kind of the layout of these conferences and how they were organising specialist CLL doctors to speak to patients about all the new treatments and how to live well with your CLL and all, we actually said, well, we need to do the same back in Ireland. So we kind of had the template from what they were doing in the UK and bringing it back to Ireland. So the first thing we did, obviously just starting out, like it was kind of a small group of us, patients and caregivers. But what we did was we decided to contact the Irish Cancer Society, a very big organisation here in Ireland. And they were actually very, very good. What they did was they said they would provide a room for us to have our first information day. And we couldn't take funding at the time from pharma because we weren't a registered charity. That caused a bit of difficulties. And I suppose it's worth saying that if there's any kind of startup organisations, That's a hurdle that you will hit, is how do you have an information day with many patients coming, and how do you fund it, you know, fundraising. So what we did was we had a small fundraiser in a sports club that actually gave us the foundation. We then contacted the Irish Cancer Society, said we would like to have this. We saw this happening in the UK. We'd like to do something here for patients. And they said, absolutely. They provided a room, and they said they would organize the tea and the sandwiches. One of the issues was very quickly was that once we put it out on social media, the room only held 40 people, and we had 187 registrations. So it just showed the need for information that patients were looking for. And that was a great success. We had a leading Irish doctor, and we also had a doctor from the UK over. So patients were able to, I won't say compare the two doctors, but compare kind of access issues even back then, and even trials. And I suppose that's really, it was difficult to get started, and that's what actually got us started. That started the ball rolling, people coming forward and helping. And then we became a registered charity in 2017. So it became a bit more easier to discuss with pharma the ideas that we wanted to have, and to hold information days. And obviously they were very receptive to us doing that as well.
Thank you, Michael. Thanks very much. Abadeo, what was the main obstacles or problems that you experienced when you were setting up your own charity?
Yeah, the first one and the big one is that the ignorance and lack of knowledge on how to establish the viable group. I had difficulties in mobilizing members. The country is so big, the population is 56.7, and the patients are scattered all over the country. And it's very, very difficult to access them. And those who decided to join the group, after some few months, they disappeared. The healthcare are also very busy. Politicians have their own priorities. And we are lacking capital. Capitals to pay for the registration, logistics, the draft of constitutions, the office rents, and the like. So all these are the constraints during our initial starting of the group.
Yeah, I think you both highlighted the problem of finance at the beginning. And although the charity I represent, CLL Support, started in 2004, not 2014, we started with a loan of £100 from one of the three first people. In fact, they'd wound up a charity which had £100 in the kitty, and she got an agreement to lend it to us. And that's where you start. You start with a few people around a table, and it grows. We now, from that very start, we now have 3,300 members, and it's a difficult progress, but the start is the key. I think the attitude of people at the start. It's a question of enthusiasm as much as else. And I can see you both have enormous enthusiasm for what you're doing, and that's quite remarkable. Can I ask you both, Michael, first of all, what do you think you did well at the beginning, and what do you think you could have done better?
Okay, well, I suppose what we did well was the information days, and providing adequate information to the patient community, that patients were coming up and they were just actually blown away with hearing. They understood their CLL from having an afternoon session with CLL Ireland. That, you know, you might have a patient that was 5 years with CLL and they didn't understand their disease, and when they came to the information day, they understood. It was great to see patients connecting with each other, that some patients, we heard it so often, had never met another CLL patient. You know, and to see patients doing well. If I moved on to what we maybe haven't done so well is really getting the treatments to the patients, is maybe highlighting it from political awareness or health service providers. We don't have an open door to discuss the issues that we have with our healthcare providers. And kind of the establishment of CLL Ireland was to try and have an open dialogue. And it's like what I said in my presentation, is that if vulnerable groups cannot put their case forward to try and get changes, because it's only small, sometimes it can be just small changes that will make such a big difference in patients' lives. And you know, that and I suppose that's where maybe we probably have failed a little bit And I'd love to know from the panel discussion here is kind of how we get over that hurdle. Again, we have the benefit, and I suppose this is where I'd say how CLLAN really works, is that we get to see all the other organizations throughout the world and how they work, and the difficulties Appendeo has been saying about his country was really difficult to hear. You know, that I know that our treatments, even though I'm saying we don't have access to novel treatments, I know that Appendeo probably doesn't have access to the gold lion standard treatments that have been around for years. So it's I know there's no comparisons, but what we're trying to do in CLLAN is to make sure that every patient around the world, no matter where they are, has access to the best tests, the best treatments. But I suppose the difficulty is, how do we get that door opened to speak to the politicians or to speak to the healthcare providers when,
Sure.
you know.
Yeah. Thanks, Michael. Abadeo, what thing would you like to have done better at the beginning that you found you couldn't do, or on reflection, in hindsight, you would have liked to have done differently?
Well, maybe instead of moving here and there, looking for members, probably I could use social media to publicize our concern, trying to reorganize or make a reorganization of our vision and mission. That instead of having the CLL patient support group, which is too specific, we have to improve a little bit, and then to have another organization that will take care of all types of blood cancer, including CLL. So members came from all subgroups, and therefore, if we do like that, maybe the majority of people will join our group.
Thank you very much. I'd like to bring Lorna in now, who's been waiting very patiently there in the background. Lorna, you're going to talk about succession, and one of the problems with many of the type of charities we're talking about is that the members have CLL, the trustees have CLL, or have partners who have CLL, which restricts them to a large extent. That they know about CLL, they understand it from a very personal point of view, but there are problems, therefore, with succession and sustainability. I wonder if you could comment a little bit on your views about that, and how a small charity can start to go about thinking about those topics.
You're right in that is exactly how most organizations form, right? It's somebody who has a close experience with the disease, who wants to make make the situation better for people that come after them. So this is what you experienced. It did not go well. And so how do we change the system or change the experience for people coming behind? And that's very admirable. But you're right, it then creates issues, especially in diseases like CLL, where the disease isn't going away, that you're going to have moments of health and moments of not feeling well. And how do you keep everybody motivated? I think partially, Michael touched on this actually a little bit when he started, and what he didn't mention, I think, about what he did well is he talked to a lot of people. He got lots of feedback from others about what has worked in their organizations and what hasn't, and helped, to kind of form a structure that way, which is great. I think, though, when you're realistically looking at your strat plan and what you're trying to accomplish, you really need to think not only about the health status of the people involved, but also looking at the skill set. Most people don't come into a nonprofit organization actually skilled already with how to manage a nonprofit organization. So what other kind of advice do you need? Now, those you could look for more people within who have a connection to the disease already, but you have to think about looking outside the disease itself. Many young professionals, especially, are looking for ways to expand their CV. And one of the ways they can do that is by volunteering for charities. So, if you need some legal assistance, if you need some accounting advice, if you whatever it might be, if you need somebody to help you with marketing, there's ways you could look at expanding who is helping you with a project and how to bring more people in. I will say you will always get the most support from people that are connected to the disease itself. There is no question about that. So then look at ways to increase your numbers. Because even though, you know, Neil talked about two of the key people in their organization did both get sick at the same time this past year, which has hard for them then to continue to manage the organization. The more people you can get involved, the more you can spread out the work and you have others to pick up when times get difficult. And the best way to do that is to actually define what you want somebody to do. I had a gentleman say to me once, how do I get more volunteers? And I was like, well, you tell me, what exactly do you want the volunteer to do? And they're like, anything. I was like, somebody walked up to you in the street and said, I want you to do anything for me. Would that work for you? Would you be willing to go with this gentleman and just do whatever he wanted? Of course not. You have to define for people what they might contribute to your organization and see if they're a good fit. If you're not putting in that pre-work, you're going to have a really hard time pulling people in. And then once you get them into the organization, you have to let them do the job you gave them. And I do think, especially where we've been involved with an organization for a while, and perhaps we're a founder, it's sometimes hard to let things go, right? You like to have your finger on everything. But if you keep pursuing your growth with that kind of mindset, then it's going to be really hard to engage other people into the organization. I will say this as well, because sometimes you create a fabulous organization and you have a lot of people, but you still don't have somebody who's willing to step up and take that leadership role as time progresses. And so I encourage every organization to have a backup plan. So if your organization, if you have nobody who's willing to take the lead, then what do you want to do with your organization? Would you partner with somebody else? Appendavio gave an excellent example of how they started working with other people outside of CLL to form a sustainable organization, because he found that CLL as a single disease group wasn't going to be sustainable. So he opened up his thinking. And so for others, potentially that's what you need to do as well. Are there other groups you can partner with to share some of the resources and the time and the effort? Do other people have similar objectives so you don't have to do all the work yourself? And you don't even necessarily have to look just within blood cancers or cancer. Sometimes you can look outside, and other disease groups are also advocating for the same thing. So are there ways you can partner to make sure that, you know, all the responsibility doesn't lie on you and the small group that you may have available to you to do this work?
Thank you, Lorna. That's fascinating, because I recognize a great deal of what you've said in our own development, particularly in the early stages of people trying to prize away the ownership from the early starters who'd done a fantastic amount of work. They really had. But in order to go to the next level and the next level above that, you need different qualities, you need different talents and different experience. And that's one of the key things. So can I ask that question to Michael first? How do you go about finding trustees that are going to fit into your organization and are going to help it develop?
Yeah, I suppose a good question. In the early years that we had a few patients, my wife Jan included. So as Lorna was saying, obviously the disease connection, you obviously wanted to do something. We also had, we were quite lucky that we had friends who had different skill sets and were quite good at setting up our Facebook page and our web page. I should maybe make the point that, like, it's the patient getting sick and maybe leaving the organization has been difficult, but also that the capacity level, that if you're asking friends to do it, it's hard to be involved in this. And as the passage of time kind of goes past, they get a little bit tired of the organization. We get tired of it too, but we have to stay with it, because you just can't give up. That we know that what can be achieved when we see what other countries have achieved by advocating. I have to be honest with you, it's been a difficult, and I suppose we had been thinking before COVID hit that maybe our sustainability would have to come from probably paid members of staff, that if we could get funding some way, but you kind of have to fix, it's the chicken and egg. You have to get the funding first before you can take someone on. And you know, it's when we're asking pharma for funding, usually core funding is not part of the equation. Maybe that's changing, maybe COVID will change that. Like pre-COVID, I suppose, had we set up maybe a year or two earlier, had we taken on paid staff because of COVID, we probably would have been in trouble trying to pay them. So it's a funny thing to say. We were fortunate that we were still a group of volunteers because we could just slow things down and keep going. But I think going forward, I know that we always talk about volunteers and people with different capacity coming forward, but just for sustainability, should it come from paid staff? That's the direction that we need to go in? You know, I was taking notes from what Lorna was saying, and I do like her idea of them young professionals that you could maybe take on, and if we could get a legal and a marketing and, you know, a fundraising, you know, that would be a good way to go. But I suppose that's a question I'd maybe put to the panel, and maybe Lauren, if you can answer that. Like with organisations, you've seen the growth of organisations. Are we at a stage now where we do need to be taking on members of staff?
So that's always a really big decision, right? About who's going to do what. But I think part of it comes down to having a really good plan, like, you know who you are as an organization and where you want to be, right? So there are many things that all of us can do, right? There is no lack of issues for us to combat, but we cannot fight them all. So you really have to be able to focus in and say, these are our priorities. And once you have those priorities laid out and a kind of a pathway of how you want to get there, is then looking internally at capacity and saying, what can we actually really accomplish? And I think, you know, it's just not a matter of capacity of like, okay, we have this many people, so you do this, you do this. No. Let's realistically look at your lives. What else is going on? How fatigued are you because of your disease or taking care of all these other parts of your life? Realistically, how much time can you put into each of these projects? And then if you have a lot you want to accomplish and you don't have the resources, then yes, sometimes the answer is seeing if you can get some paid help. You're right that most companies, pharmaceutical companies, won't fund or do core funding, right? But you need to also think when you're asking for funding, then you have to think about those project management fees, right? They should be included in all of your proposals because there is time and effort putting into this. There's time and effort you put into having all of those meetings with the pharmaceutical companies. Never mind if it actually comes, comes to a specific project. So, and also really you need to start looking at funding outside of pharmaceutical companies. So are there ways to do fundraisers? I will say, you know, across the board with the COVID impact surveys that we did this year with the Global Cancer Coalitions Network, fundraising was down 40% across all of the cancer groups, right? So it's a significant drop that we saw during COVID. At the same point in time, volunteering is down 70%. 70%. So the expectation that you could do the same amount of work right now that you could pre-COVID for many groups is just not possible. So you also have to be willing to go back and relook at those plans and relook at it in light of where the world is now and what the impact has been on you personally. There are some groups that saw increases in their fundraising over COVID, but they were the minority. Right, but they found ways to connect with their community in a different way, and were actually able to secure more money, which is fabulous, through different virtual events. But most people faced a loss. So maybe I think even for pharmaceutical companies, if you are pharma dependent, funding is still decreased. over what it has been pre-pandemic, as they also navigate through the impact of the pandemic on their own business. Same with local corporations you could normally depend on. For most people, I'm going to recommend it's probably not your best time to try and look for move your organization to a different level unless you have some really reliable funding in place. Can I also say one thing though? We've been in rooms where we've asked everybody, and there's organizations of every different size. So from very small organizations who raise a few $1,000s, or to very large organizations who raise millions and millions a year. And we ask who has all the money they need, and nobody ever puts up their hand, right? So money isn't necessarily your answer. What you really is having that detailed plan of who it is you want to be, realistically looking at your capacity, and then prioritizing what we're going to accomplish when. As you build your reputation, some of those other things will come into play naturally because you're meeting those objectives. If you start trying to do too many things at one time, there's less chance you're going to be successful. So really, really focus on doing those important things first and building your reputation, and it will help you immensely.
Thank you, Lorna. I think that's absolutely true. It's very easy to try and do too much too soon and not have the capacity to do it. And you end up by doing nothing terribly well. Amadeo, could I ask you how you're recruiting your fellow team? You don't have trustees as such, I don't think, but you have a team of people. How do you go about recruiting them?
Well, it was a little bit difficult because initially when we are trying to call them for the first meeting, people were a little bit scared, and we are a little bit unfamiliar with what is going to happen later on. But then what I did, I tried to make some sort of calling people face to face and to see whether they can hear from me. So we did a very simple thing, that is to try to explain the major objective of the organization, let them know what is going to happen later on, and why are we there, and what are the intended priorities or the visions of the whole issue. So by telling them exactly what is going to happen, the majority of people decided to come in. I was very much surprised because initially I didn't know that there will be some people who will be very much interested. But soon, after introducing the idea was welcomed, and people were ready to work with me faithfully, and member was good. In our first meeting, almost 95% of the invitees were able to attend the sitting, and the contribution of the members was very high. Although we didn't have enough finances, but we had no money, but people or members spent their own money from their own pockets to run the activities. The organization was not able to buy even a drink for the members, but members themselves, everybody uses his own cash to buy some drinks. So willingness of the people to come and spend their time was very much valuable to us. So I decided to take this as an opportunity and let them be with me and work very closely and have a soundable meeting. Sometimes after having a sitting, we came to learn that we have been conducting a meeting of which we have people of different expertise. And therefore, these people were able to contribute according to their specialties. And we came up to a consensus that all these people are very, very much needed in the organization, and therefore we needed to appoint or upgrade them in order to have a sustainable organization. Willingness to spend their time was very, very, very important, because sometimes we were spending time after office hours, sometimes during weekends, but people were willing to come and sit down and do something for us. That's what we did.
Thank you. Have you been surprised, Apideo, about the level of commitment required in terms of time, energy, and stress levels? And I'll ask Michael as well after you've answered.
The time management, well, people didn't get time to come during office hours. They decided to come after office hours because in office hours, everybody is busy in the office. But thereafter, people were able to come and sit down, even in the evening, even sometimes in the weekends, in Sundays, Saturdays. So we were able to take some few hours, we sit down. Sometimes we call upon one another during the off hours, we sit down, we do something, and that's what we have been doing.
Thank you. Michael, yeah, stress levels, commitment.
Well, sometimes advocacy is not for the faint-hearted, but we do have to do it. And I mean, there's great kind of enthusiasm from, especially actually when pre-COVID, when we could meet face to face with the patient community. Great enthusiasm from them days, and that would carry on nearly for months. I suppose since COVID has hit, we were quite fortunate. I didn't mention it on my slides. I meant to mention it, that we did a HTA for venetoclax and obinutuzumab for untreated patients, which, as we know, would be a game changer if we could get that made available to patients. But
Michael, could you explain what HTA is for the uninitiated?
Well, I suppose, yeah, I suppose kind of to put it simply, it was putting the patient experience of living with the disease, CLL, to our healthcare providers, so that they would know that rather than it coming from a doctor, patient's viewpoint is always. So that's really what it was. It was we had to put the patient experience down, and we reached out to the patient community, and the stories that came back of them living with the disease, I was even surprised. We're dealing with CLL 10 years now, and I thought I'd seen everything, but to see the difficulties that patients are having around the country, and I think it was a really, really powerful submission. But the reason I mention it is that we were quite fortunate. It just out of the woodwork, one patient contacted us and said that asking us, were we aware that a HTA had to be done on this, and she'd like to help out. And that was fantastic. She pretty much helped us put it all together. I was able to provide the information again to show the benefit of the CLLAN network is that this has been done in other jurisdictions. It's been done in Canada, it's been done in the UK, it's been done in France. And we were able to put all that information together, not just the patient experience in Ireland, but the patient experience in other countries. It was a powerful submission, but it just showed when we kind of grouped together. And that wasn't, well, I suppose when we talk about money, about keeping the lights on, this wasn't about money. This was people putting themselves forward to put in hours and hours of work. And I suppose, Lorna, you know the amount of work that goes into these. They really take over, you know. But I suppose it was really, really good, and it was good experience for us as well, because when we started this journey, CLL journey, it's one area that we wanted to. It's like I said, there's no open door, but I suppose that's the door maybe slightly opened, kind of hoping that someone comes back and maybe asks us questions, and that we can really give it to them. You know, that's what we need. You know.
Yeah, I certainly from my point of view, and I suspect from both of yours as well, that it is very rewarding. When you get a drug through, when you talk to a patient and they begin to see what it is they can do for themselves, and when you give advice to patients, it's extremely rewarding, and really that's the best thing. Forget the money side, because I suspect none of us get paid at all, but that's worth a lot. Lorna, can I just go back for a second to talk to you about how small organizations such as Michael, such as Adeo's, start to prioritize what it is they should be doing? Because as we discussed, it's quite easy to try and do everything at once. So how do you itemize priorities that you should be looking at?
Nobody can do that except for you. So really, it's with a local organization, with that group of dedicated volunteers that you have, your dedicated team, really sitting down and saying, why are you here? What got you to the table? And having that kind of a discussion, because then you will start to see the commonalities amongst you. Are you there because you had a really hard time finding good information on your disease? So you want to make sure there's good information available. Was it because you had a hard time getting diagnosed? So you know that there is something broken in the system because it took you so long that you want to fix. Is it like Michael, your wife having to travel to a different country to access a clinical trial that works for her because nothing is available locally? So it's having those conversations and putting it all on paper, because, you know, I like paper, but whatever it is, you have it all written down, and then you can start agreeing on priorities within that. And I really think if you're going to maintain the enthusiasm of your group, you're going to have to agree to a limited number of priorities, might be 3, maybe 5, and work towards those to start with, and figure out what are going to be your key activities within those areas. And if you don't do that, if you start getting involved in every little issue that comes up that are raised by other people, they may be just as important. But you might, if you're not actually achieving some of the goals for why you started the organization or why you became involved, you're not going to maintain people staying with you, right? That's when they're going to drop off because this organization doesn't represent what they need. So this is not a one-time process. You should be doing this regularly just to make sure, especially as you're bringing new people in. Times change, as we all know. The pandemic had an influence on a lot of different groups on how they function and what they should be doing. So it is a constant reevaluation for sure, but you need to start there. And I really encourage people, you have to have a plan of what it is you're trying to accomplish. Nonprofits have a different reason for existence than a for-profit company, but you still need a really good plan so you have that, you know, knowledge for everybody about who you are and where you're trying to go. And actually having that plan means when all this other stuff, the noise comes up from other places, you can go back and evaluate against your plan and say, okay, this fits within what we're trying to do, or this is in what we're trying to do. And it doesn't mean just because it doesn't fit that you don't do it. It means that you have a discussion and then realize if you're going to do something new, you may have to give up something on your existing list. And it takes out some of the angst and emotion, I think, that may cause some disruption within a group of very dedicated people if you have this playbook detailed out.
I wish we'd had you as an advisor in our early days. It would have saved us an awful lot of time and effort. That they are, on reflection, they're very simple, straightforward things. But if you don't know them in the sort of the mess that you're in at the beginning, you don't really understand it. And we could have saved so much time, I know. Let me just go to some other questions that are coming in. Both of you, Michael and Abhito, do you have a Facebook page? And it says, how do you make sure the misinformation isn't shared, and how time consuming is this? I think it's a problem for all of us, basically.
Moderating. Will I go first?
Yeah, please, Michael.
Yeah, we've actually 2 Facebook page. The first one we set up, we thought that we were setting it up for patients to communicate with each other, but it ended up actually being a Facebook page supplying information. So that if there was maybe the EHA conference or the American Society of Hematology, we were putting that stuff up, the patients would click like on it, but they wouldn't really get into a conversation. So COVID kind of forced us into creating a chat page, a private chat page. And that's been interesting because we can get to communicate with the patient community. It was very good on the vaccination rollout, as I mentioned earlier on. And it's very good. We have a trial now here in Ireland CLL17. So some of the patients that are on that are actually coming on and sharing that they're on it or what arm of the trial they got. So it's been good to watch the patients communicating with each other. Regarding moderation, we pretty much watch it every day. CLL, as anyone that knows me, I could talk about CLL, which is probably the wrong thing to do, but I could talk about it 7 in the morning as soon as my eyes open to 12 o'clock at night. So I know it's not a good thing, but it's more like a hobby. So I don't mind going in and checking. And we've been very fortunate. I've seen it in some of the international sites. Some of the ways it can go wrong, the moderation is people posting kind of the wrong things or wrong information. We've been quite fortunate. It hasn't happened yet, but I kind of am aware of it. And like I say, we check on it. We don't leave the Facebook page 2 weeks without anyone going in and checking. And we have, I think that Fanula, who looks after our Facebook page, you know, the way you can do words, that if someone types a word, a certain word, I mean, we're all getting it now. When you type something about COVID, you get a message up, you know, that's, you know, so we thought we were all in trouble at the start, but we weren't. But that's pretty much it. They've worked very successful to us, you know, them Facebook pages.
Abadeo, do you have a Facebook page? I'm not sure you can hear us.
Yeah. Yeah,
Good.
I can see. Okay, thank you. No, we don't have one, but we are in a process of establishing one. We are still using WhatsApp as a communication media for us. We don't have Twitter yet. And since our organization is still young, we are now trying to find the best way we can start the Facebook and the other medias for our group. But for the meantime, we are using WhatsApp as a media of communication. Yeah.
Abadeo, staying with you for a second. Another question is, how many of your people, your patients, have internet access at all?
Well, I can't say. The majority of people do not have internet. They have cell phones, and very, very few are using internet. But yes.
So how do you communicate? Yes. How do you communicate with them?
We communicate through SMS, short messages, and WhatsApp. That's all. There are some people who are using internet, and the people in the urban areas are using internet, and some people in the rural areas are also using internet. But we are still in a process of trying to mobilize people from different areas. Once we are fully established and get registration, we will try to find the best way of telling people what the organization is through the medias, radios, and some forums. Otherwise, at the moment, we don't have Facebook.
Yeah, I guess what you're trying to do is build up a network of some type, which must be very difficult under the conditions in your country. But it sounds as though you're gradually progressing it.
Yeah.
Yeah, Michael, you presumably are building up your network as well. You've had a lot more experience than Abadeo.
Yeah, well, I suppose I'm listening to Abadeo, and I suppose the internet access hasn't been an issue. I suppose we deal with an older population, so maybe that has caused difficulties. I'm kind of always aware that when we would have our information days, that the patients are coming are maybe younger CLL patients and quite well. So I know when I'm looking in the room that we're not seeing the patient community that are around the country. So that has been a difficult area, and it's an area that we're trying to improve by supplying like printed information that we can send out to all the hematologists and doctors and cancer centres, especially in the rural parts. We have like our Facebook page at the moment has about 100 patients that all communicate with each other, and I think our other Facebook page that supplies the information, I think has about 950. The last time I checked. Someone's going to check it now and tell me I'm wrong, but I haven't checked that part. But I check the moderating what people are posting to each other, but I don't check the numbers.
Yeah, we spoke about the problems with moderation because there is so much misinformation, some of it quite deliberate sometimes. And on our forum, we have about 17,000 members, and you're bound to get in that number a few that are, well, let's say not of the mainstream. And it's basically a full-time job to try and moderate that sort of size. We have 3 administrators and 7 volunteers looking at it because it's worldwide. So you need people all over the world. And as you know, Michael, it's very it's fascinating. We think it's extremely useful to people, particularly new people coming in, because there's a mine of information there. But keeping it under control is very, very difficult. Can I ask you, Michael, how important is it for you to have contact with and a relationship with consultants, both in your country and also?
Yeah, that's a really good question, because I suppose I would maybe complain about that when I see the difference in other countries, like the UK, that you seem to have a very, very good relationship with consultants and being able to get consultants to come to information days and things like that. COVID has highlighted a huge amount. And one of the things here in Ireland is that we had no consultant that actually came forward that would actually say what way patients should be living their lives. So they've been relying on government information. And as you know, the government information is for the general population. It's not for our patient community. So where we had patients, when I was actually posting about the results of vaccination, I know that's up on one of the questions, that CLL patients have a reduced response to vaccination. A patient contacted me and said that the post actually quite upset her. And I tried to say to her, well, this information is power, because once you know that, you'll be careful when you're going out and about, rather than listening to the government advice. And even actually from our chief medical officer, went so far as to tell elderly people that they can now hug each other. And now the Delta variant is on our doorstep. It was just crazy stuff to sit and hear it. So, you know.
Yeah, so COVID has impacted, I think, for everyone, basically. Have you had problems in your own community in terms of being able to staff and to handle the website and so on?
Is that the question for me?
Yes, please.
Yeah. Well, we're a small operation, so we're quite lucky. And myself, Jan, Fanula, is very heavily involved in moderating them sites. So we've been, I suppose, like what I mentioned earlier on, it was quite lucky that we hadn't maybe taken the organisation to the next stage pre-COVID, because we've been able to, and even slowing down where we might have got a bit worried that we if you slow down too much, will it end? It hasn't actually been too bad. It's okay to slow down. I know Lorna had mentioned about, like, you might have 20 activities, but bring it down to 5. One of the things that we did was, again, pre-COVID, is we had strategy meetings. That's something that I learned from my involvement in CLLAN. And that's the wider community, our wider network, that we can learn from that, is to watch CLLAN having maybe strategy meetings. We did the same. It was very beneficial. And then 20 activities did become 5. You know, that's it. 15 of them had to go over to the side, you know.
Yeah, it has to work like that, doesn't it? Abadeo, could you speak a little bit about how COVID has affected your operation and the way you are behaving at the moment? I think you're muted, Abadeo.
Yeah, I'm saying, although we had no lockdown in our country, but still it was too difficult to travel and make follow-up of some issues. And we had a slow moving of issues, looking for registration and formalities. It was not possible to hold a frequent meeting as scheduled. Plans and objectives set were not yet met as planned. And restrictions set by the authority prohibiting unnecessary gathering. So we were not able to have face-to-face meeting. And no online meeting among patients, since some do not have facilities to enhance them to do so. And there is an increase in tension and fear. This led to immunity instabilities to some people. So those are the few impacts that we have realized in our country.
Do you have a vaccination policy in Tanzania?
Yes, we have.
Yeah, and how many people are currently vaccinated?
Well, no, I can't mention now because I don't have any statistics about it, but we are having it.
Good, good. That's good news. That's good news.
Yeah.
Yeah, Michael, we have time, I think, for perhaps one more question, or maybe a couple. The knowledge about CLL, getting information, things are changing so rapidly at the moment with new treatments coming out, and particularly with COVID in the background anyway. How do you gain knowledge? How do your the people that help you in the charity gain knowledge?
I suppose it's like from day one is we found when we reached out to the international community, and the first of all was from other patients, and then from the doctors around the world that are very good at speaking at different conferences and all, and recording videos and interviews and all. So I think that our patient community would nearly be more informed of what's going on in EHA, because their own doctors maybe in Ireland haven't travelled to the conferences. And what we do is we disseminate the information. The difficulty, of course, is that they hear all about all these new treatments and then realize that they can't access these treatments. So it's very, very hard to there is a formula for the way patients should be treated or what should happen, but it's not, that pathway is kind of not set. It's still a rocky road in Ireland. Like even down to the ERIC accredited labs to carry out prognostic tests, mutational tests, and we don't have here in Ireland. So the tests are going to the UK, and we hear back from some patients that the doctors are unwilling to do the tests, even now in 2021. And that's nothing to do with COVID. That's just so we try and inform the patients. It's really, really important that they know, you know. And that's the important thing of advocacy as well, is that I'll do a saying, informed patients have better outcomes. I heard the doctor saying it, so it is actually very, very true, and we see it.
There is some research that points to that, definitely, because the patient will ask questions, and there'll be pointed questions. Michael, and also Abadeo, Michael first, does what you've just said mean that you're becoming much more of a campaigning organization?
No, do you know what I think actually? Yeah, you're right. I know when I hear myself talking, you probably see me on the steps of Parliament, but I suppose if you look at Neil Graham, that's what they've had to do. They've had to take the protest to government. It's really, really unfortunate that this is happening, because as a community, we're all going to be patients one day. But campaigning is the big part of it. And I think probably one of the difficulties that's as we move forward now is we're now not just advocating for patients to get the best tests and best treatments. COVID is a totally different ballgame now. We now have to advocate for our immune compromised patients to maybe get prophylactic treatments. And you know, if we can't even get an inhibitor over the line that my wife started on in 2014, and we're at 2021 now, if we can't get the inhibitor over the line, how are we going to get prophylactic treatments for CLL patients so that they can go and live their lives? You know, so that's the campaigning. You know,
that's the campaigning, and has to be done. Abadeo, do you regard your organization as a campaigning organization?
No, not yet. Because, you know, our foundation is not yet registered, but we are going to be registered some few weeks to come, maybe 2 weeks later. And from there, then the activities will take place. Otherwise, there is no any campaign that we can handle right now because of the rules and regulations set by the government. Unless we are registered, legally registered, and have all the authorities to do, we can't do any sort of campaign.
Right. Well, I think we've just about run out of time. So can I finish by thanking everyone, particularly our panelists and everyone who's logged on today. I found it huge. I've been hugely impressed by the dedication and the work done by everyone. And I think it illustrates that with the right support, we can truly make a difference. I know Michael, and you, Abadeo, you are making a difference. It's been truly inspirational. Finally, perhaps you'd put these dates in your diary, please, when they come onto screen.
Will I tell everyone about these dates?
Yeah, I think that could be on the screen now. Yeah, if you could, please, Michael, just sum up and
okay.
There we go.
Well, I suppose summing up what we've kind of witnessed from the 3 organisations, and mine included, is the difficulties that organisations have on sustainability and moving forward, and trying to stay enthusiastic. But it's meetings like this when you see we see how important it is actually to work together and help each other and advise each other. Just to finish up is to let you know, to save the dates, that we have a few important dates coming up for our CLL community. And the first is the World CLL Day, which takes place on the 1st of September. This is the very first day that's dedicated to CLL. And what I will say to you all is that CLL patients are immune compromised. COVID has made every person in the world immune compromised. It's made patients know what it's like, maybe, or give them an insight into what it's like to be a CLL patient. And what we'd like to do is get you as our network to help us promote and highlight the issues for CLL patients. And I think that we can maybe turn COVID into an advantage. But just watch our social media and prepare to share our slides. That follows on World Leukemia Day on the 4th of September, and then World Lymphoma Awareness Day on the 15th of September, because, as you know, September is Blood Cancer Awareness Month. So I suppose the only thing I'll say is, I've mentioned it, is the vulnerability of CLL patients is continuing during the pandemic, and we all need to work together to highlight these issues. And look forward to working with you in the future, and hopefully we'll get to meet face to face. And thanks very much for your time.
Thank you, Michael. Thank you for everybody. And stay well. Thank you for joining us. Stay safe.